Dopamine. Dopamine is an organic chemical of the catecholamine and phenethylamine families that plays several important roles in the brain and body. Indications: adjunct to standard measures to improve BP, cardiac output, urine output in treatment of shock unresponsive to fluid replacement. Increase renal perfusion, low doses. Action: small doses 0.5 to 3 mcg per kilogram per minute stimulate dopaminergic receptors producing renal vasodilation. Larger doses 2 to 10 mcg per kilogram per minute stimulate dopaminergic and beta-1 adrenergic receptors, producing cardiac stimulation and renal vasodilation. Doses greater than 10 mcg per kilogram per minute stimulate alpha adrenergic receptors and may cause renal vasoconstriction. Therapeutic effects: increased cardiac output, increased BP, and improved renal blood flow. Pharmacokinetics: absorption administered IV only, resulting in complete bioavailability. Bioavailability: distribution widely distributed but does not cross the blood-brain barrier. Metabolism and excretion: metabolized in liver, kidneys, and plasma. Half-life: 2 minutes. Contraindications and precautions. Contraindicated in tachyarrhythmias, pheochromocytoma, hypersensitivity to bisulfates, some products. Use cautiously in hypovolemia, myocardial infarction, occlusive vascular diseases. Older patients may be more susceptible to adverse effects. Pregnancy and lactation. Safety not established. Route dosage: IV, adults, dopaminergic, renal vasodilation, effects 1 to 5 mcg per kilogram per minute. Beta-adrenergic, cardiac stimulation, effects 5 to 15 mcg per kilogram per minute. Alpha-adrenergic, increased peripheral vascular resistance, effects 15 mcg per kilogram per minute. Infusion rate may be increased as needed. IV, children and infants 1 to 20 mcg per kilogram per minute, depending on desired response. 1 to 5 mcg per kilogram per minute has been used to improve renal blood flow. IV, neonates 1 to 20 mcg per kilogram per minute assessment. Monitor BP, heart rate, pulse pressure, ECG, pulmonary capillary wedge pressure, PCWP, cardiac output, CVP, and urinary output continuously during administration. Report significant changes in vital signs or arrhythmias. Consult physician for parameters for pulse, BP, or ECG changes for adjusting dose or discontinuing medication. Monitor urine output frequently throughout administration. Report decreases in urine output promptly. Palpate peripheral pulses and assess appearance of extremities routinely during dopamine administration. Notify physician if quality of pulse deteriorates or if extremities become cold or mottled. If hypotension occurs, administration rate should be increased. If hypotension continues, more potent vasoconstrictors, norepinephrine, may be administered. Toxicity and overdose: if excessive hypertension occurs, rate of infusion should be decreased or temporarily discontinued until BP is decreased. Potential nursing diagnoses: decreased cardiac output indications, ineffective tissue perfusion indications. Evaluation, desired outcomes: increase in BP, increase in peripheral circulation, increase in urine output.